Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give the valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the study. My dear friends, in the last class, we have been discussing about head size and its importance in the clinical practice. Okay, head size which is less than 2 standard deviations statistically and less than third percentile is considered as microcephaly, and today we will look into some of the important aspects related to clinical examination related to microcephaly. Now microcephaly, the definition we know that less than third percentile or less than 2 SD. Now, if the damage to the growing brain occurs, we know that brain is very rapidly growing in the first year of the life. Actually, this process starts from the fetal period itself. In the fetal period also, brain growth is going on maximally. Therefore, fetal nutrition is also very important. Nutrition to the pregnant mother, okay, Garbhini Paricharya is also equally important to have the optimal growth and development of this particular brain, okay, psychologically and as well as structurally and functionally. Now, if the damage to the brain occurs, especially in the rapidly growing period of the brain, in the fetal period and first year of the life, maybe in the early postnatal life, for example, immediately after the delivery, okay, so there is some asphyxia-like condition, mucosal aspiration-like conditions, intraventricular hemorrhages, any conditions which leads to hypoxic encephalopathy, HIE, ischemic encephalopathy, that is a big threat to the growing brain. That means brain growth will be arrested because of this particular pathology. Okay, and that definitely leads to microcephaly. When the brain growth is not up to the expected mark, that is brain parenchyma formation is less. When the brain parenchyma formation is less, the microcephaly will be there because brain will not be grown up to the mark, and as a result the skull size is also not increasing. That's a simple logic. Okay, so therefore one of the biggest threat is asphyxia and related conditions leading to hypoxic ischemic encephalopathy. Okay, where the growing brain is arrested. Growth of the brain is get arrested. So this is one of the important causes. Cause may be anything. Cause may be any causes which leads to hypoxic ischemic encephalopathy. And some of the early postnatal causes also includes conditions like kernicterus. Kernicterus is a complicated conditions of a neonatal jaundice when it is not able to, when it is not under control. Unconjugated bilirubin is very dangerous and it is poisonous. Toxic material when it stain the brain parenchyma may be leading to kernicterus-like condition. So that may also lead to decreased brain growth. Okay, so this is one important thing. Number two, at times due to the fetal insult, I told that this rapid proliferation of the brain tissues is not only in the postnatal period, first year of the life, it actually begins from the fetal life itself. Okay, so now if the fetus faces some of the threats, what are the basic threat for the fetus in the uterus? So that is from the intrauterine infections of the mother. Intrauterine infections of the mother, or if there is some problem in the perinatal period itself, if the child is having some intrauterine infections because of which child has become IUGR, or child delivered as low birth weight babies or preterm babies, etc., or if there is some congenital abnormalities related to the growth of the skull, anterior pole of the neural crest, posterior pole of the neural crest, we know that if there is some problem in the anterior pole fusion, that may lead to so many cranial abnormalities. Okay, so that cranial abnormalities may also lead to microcephaly. Number one, intrauterine infections. Many of the intrauterine infections, torch infections, will have microcephaly as one of the most common complications. Okay, starting from the Zika virus, toxoplasmosis, cytomegalo, they have got so many other symptoms, but microcephaly will be also there. Okay, so this is a second important cause why microcephaly occurs in the fetal period. So therefore, immediately after the birth, taking the head circumference is very important, because this gives an idea. This gives an idea that whether child has got some suffering or some problem in the intrauterine period. If a normally delivered child is delivered a term delivery, but head circumference is only 31 centimeter. Child is not preterm, okay, or child is not child is not low birth weight, but still the head circumference is 31-32 centimeter. Then we can anticipate that yes, something bad has happened in the fetal periods. So this is another importance of the head circumference to identify the microcephaly. Now, many intrauterine infections, there will be microcephaly as the main symptom, I told earlier. Now, child delivered with certain genetic disorders. Sometimes the child which is delivered because of the genetic disorders, commonly is trisomies. If you're talking about trisomies, child delivered because of the trisomies will also have the microcephaly as the main symptom. Will also have microcephaly as main symptom. Suppose if you take a Down syndrome, microcephaly will be there. Patau syndrome, microcephaly will be there. Okay, Edward syndrome, microcephaly will be there. So there are so many other disorders are there, syndromes are there, where the child is having microcephaly. Okay, that's another important thing. Again, it suggests that the problem is existing from the fetal period itself. So much before the functional delay evident clinically. So what is the importance of taking this head circumferences before the evidence of any of the symptoms of that particular disease? Just by looking at the microcephaly, we can anticipate so many other problems. Before the functional problem begin, before that only we can diagnose the disease and we can start the treatment and we can try to give the early cure. Okay, so that is one of the very important things. So severe measurement of the head circumference is very, very important. Now, talking about this microcephaly further, as told earlier, almost all the babies with the microcephaly will be having developmental delay. In general talking, I am talking in general. Suppose if the baby is having microcephaly, usually 99% of the babies we will have some one or the other type of developmental delay. But there is one exception. What is that one exception? There is a trait, that is autosomal dominant trait of microcephaly. What I mean by this? This means that genetically in some of the families, what happens is this microcephaly has been running as an autosomal trait. All the family members are having small head size. Okay. So now it is a benign condition and autosomal dominant. Therefore, autosomal dominant means it will not skip the generation. Everybody will be going to suffer. Male and female both will suffer. Okay. So which means that one of the parents will have this small skull, because of which the children are also having this small skull, and this is absolutely a normal condition. So what happens is here the cognition power and functional capacity of the brain is absolutely normal, and this is not abnormal. This is one exception, because otherwise in 99% of the cases, if microcephaly is there, the children will have one or the other developmental problem. Global developmental, starting from global developmental delay to isolated delay. Okay, but it will be there. Okay, but this is one exception. Now, however, there is another cause of microcephaly which is very common. What is that? And that is sutures of the skull are fused very early. Sutures of the skull are fused very early. Now, what about these sutures? At the time of the birth, the sutures are widely separated. Okay, 1 to 2 centimeter. So because they know that we should not fuse now, because brain has to develop in the first year. After all, the completion of the development of the brain, then only we have to fuse. This common sense is there for the sutures. Okay. Now, therefore, they are widely separated, 1 to 2 centimeter usually. When they will go into fuse, there the fusion starts after 12 to 18 months. That means almost all maximum brain growth happens. Okay. Then only they start fusing, and they permanently fuse after 2 years, and this permanent fusion of this sutures will take place at the adulthood, mostly in the adolescence period and adulthood, early adulthood period. That means such a long time gap is there. That means it will give all the opportunity for the growing brain. Only once the growth of the brain is completed, then only we will go into completely fused. Till then we are flexible. If the brain growth is happening, the head size also increases. Okay, accordingly to accommodate the growing brain. But sometimes what happens, due to some of the problems, this fusion occurs early. Okay, this is called as premature closure of the sutures. This is called as premature closure of the sutures in the infancy. Then what actually happens is the growth of the brain will be affected as there is no space. There is no space. Therefore, growth of the brain will be going to affect. Okay, so such situation may be present because brain is, see, suppose the premature closure has to happen in the 10th month itself. Lot of brain has to grow now, isn't it? But there is no space. So, but brain continues to grow, but there is no space. Now, brain is pushing this the bony portion, but there is no space. So now this leads to the symptoms of increased intracranial pressure, vomiting, and all these things. Headache may start, and this may at times need surgical intervention to provide some of the spaces. Okay, so this is one important condition, that is premature closure. But the same thing has been explained by Bhaishyaji Ratnavali explains two very important diseases. One is Mastishka Chaya and another one is Mastishka Apachaya. Mastishka Chaya and Mastishka Apachaya. Mastishka Apachaya means atrophy. Okay, so it refers to cerebral atrophy, where the bone, the cranium size will be normal. Okay, and normally it is going on, but the brain size itself is very, very small. That is cortical atrophy like conditions. Another is Mastishka Chaya. Mastishka Chaya is happening. Mastishka is growing, but for the growing brain, the cranium is not able to provide the sufficient space. Okay, Mastishka Chaya and Mastishka Apachaya. These are the two important disorders which is mentioned in Bhaishyaji Ratnavali. Practically, this is nothing but one is a premature closure of the, one is microcephaly. One is microcephaly due to premature closure of the sutures, and second one is a cerebral atrophy. Okay, now this is all about microcephaly. In the next class we will discuss about macrocephaly. Thank you very much.